and welcome to Video 3 News. I'm Nikki Anderson. Carers in this country save the NHS £11 billion per year, and organisations like Carers Scotland go a long way to support carers in their day-to-day lives. Gabriella went along to speak to Fiona Colley to hear more about it.
Hi Fiona, thanks for joining us today. There are 750,000 carers currently in Scotland. What would you say are the roles of carers?
Carers are vital in ensuring that older people, people with long-term conditions and people with disabilities are able to live in their own communities, to be able to live at home as independently as possible. To put it in context, carers, there are more carers in Scotland than the whole of the health and social care workforce put together, so their role is absolutely vital.
What would happen without these carers? Well,
carers save the economy over £10 billion every year. And 3 in 5 of us will be carers at some point in our life. To be honest, health and social care would collapse without the contribution of carers. It just would not be possible to provide the support that people need.
And what actually happens when someone's diagnosed?
Well, obviously it's a really difficult time for family members and carers, and it can be a point where people need information and carers need information, but quite often it's not available. There's no off-the-shelf guide. We've been working with hospitals and GPs and other practitioners to ensure that carers and people who are newly diagnosed are given information, for example, about a local carer centre or a local condition-specific group, so that they know where to go when they're ready to get that support.
So what sort of role does technology play?
Technology it's not relatively new, but it's quite new in the things that it can do. Most of us know the idea of something like a community alarm, so if someone falls that they're able to alert someone. But there's so many other things that are happening now, from remote health appointments to, for example, your GP being able to monitor something like a condition like COPD, right through to apps that help you and your family manage the care, for example, health appointments and other appointments, support, medication, and we've got one called Jointly.
What's the least understood thing about caring?
Probably the least understood thing, and actually the thing that we spend most of our time trying to solve, is that carers don't recognise themselves as carers. We talk about carers a lot now, and I think it's much more in the public domain about caring, but most people, the first thing they recognise themselves as is, my mum needs help, I'm a daughter. My child needs help, I'm a parent. So they don't really think of themselves as carers. Our research has found it's been about 5 years before anybody recognises themselves as a carer. And during that time, they're missing out on a lot of support, practical and financial, that's available.
And you believe people shouldn't be left alone to care?
Absolutely, and that's our primary purpose, is to ensure that carers get the support and the entitlements that are available, so that they don't have to care alone.
Fiona Colley, thanks very much.
The Technology Charter for People with Dementia in Scotland was launched in December last year. Annalise has more.
Thank you, Nikki. I'm here today in Kilmarnock at the Dementia Resource Centre to talk to Sandra and Joyce about their Technology Charter. So thank you very much, Sandra and Joyce, for joining us today to talk about the Technology Charter. So what is the Technology Charter all about?
Well, technology is part of everyday life now. I mean, I think we all use bits of kit, bits of technology, and we don't even think about it really, we just use it. So really with the Charter, what we're trying to do is to raise the awareness of the public and the professional alike in terms of what technology can do to support people living with dementia, to have a better life, better quality of life, and also to reduce stress and distress for people living with dementia. So really, what we're trying to do is just use everyday technologies and think about them maybe a little bit differently. So we're hoping with the Charter to raise that awareness.
So why did you call it a charter?
I see, there's a lot in a name. And the thing about a charter is, if you look at the definition of that word, it's actually a document issued by a government that gives rights to people. And it's also a document that outlines the principles and the values that really underpin the topic. So we called it a charter because the Charter for Technology sits alongside the Charter of Rights for people living with dementia. That's all about citizenship, that's about inclusion. and that's about human rights. And our strategy in Scotland for dementia is a human rights-based strategy.
So what are you doing to breathe life into the Charter, and do you feel that you're really making a difference?
Well, we launched the Charter last December at a conference, and here's the Charter here. It's a document, it's a piece of paper. So how do we make that live? And I think that's the challenge now. So we're doing things like we're at conferences, we're doing workshops, presentations, we use social media. Well, it's about technology. We should be using technology. So we're using social media to get the word out there. But we're also asking organisations, businesses, entrepreneurs, innovators in the technology world to sign up to the Charter. So we're promoting the Charter as best we can, so that people understand what it's all about and think, well, how can I make a commitment to take this forward and make a difference to the lives of people living with dementia in Scotland?
So Joyce, how can people find out more?
So if people want to know more about the Charter, if they want to go into Alzheimer's Scotland's website, you'll be able to download the Charter in its full form. You will also be able to go into Dementia Circle, which is one of our associated websites, and you'll find the Charter there, or some of the products that might be useful on Dementia Circle as well. So you'll find out more there. Also, as Sandra said, she's very active on social media, so you'll find her on Twitter. And we have an email address that people can get in touch with us, and if they want individually to get some questions answered, just to find us there.
So what's next?
What's next? We have a lot of exciting things in the pipeline. We are interviewing this Thursday, the 18th, and Friday the 19th, for 4 new posts. They're going to be 4 senior technology coordinators who will be based around Scotland, who will be tasked to take forward the vision of the Technology Enabled Care Fund with the principles of the Charter, making sure people with dementia, their families, the workforce become enabled and more informative about how dementia can change people's lives.
Well, we're also writing some supporting materials, so we're thinking about the different kinds of technology and suggesting to people how you could maybe use those technologies. So we've got a little leaflet that will be coming out quite soon, and it's like a kind of why not think about. So if you're thinking about, well, how could I feel safer, or how could I walk safely and go out and about and carry on my ordinary everyday life? We've got some suggestions in that leaflet, so I kind of why not think about these things. So we're talking about different apps and different bits of everyday technology that we all have. So exploiting like smartphones, tablets, that kind of thing. So we've got that coming up.
Yep. Also in our resource centres, in Alzheimer's Scotland resource centres, where you'll find where resource centres, the nearest one to you on our website, again on Alzheimer's Scotland website, we have pieces of technology or pieces of everyday equipment that we use here or that people can see and perhaps borrow. They can take that away and have a look. So if you want to see something, like up close and personal, you can do that. But also on the Dementia Circle website, we're going to be hosting all the information that we have on the leaflet. We're going to have that on the website so people can go in and kind of dig a bit deeper round about, things that might work for them, from walking technologies right through to a kettle.
Sandra, Joyce, thank you very much.
The Scottish Fire and Rescue Service does so much more than the name suggests. We are joined in the studio today with Graham Barclay. Thanks for joining us, Graham.
Hi Nikki, thanks for having me.
So Graham, tell us a bit about the role of the fire service.
Well, the role of the firefighter has changed over the years. What we used to do, or the traditional role of the fire service, was just to react to fires. Now we've become more preventative. A huge part of what we do in the fire service now is prevent fires before they start and make people safer in their own homes. That's not just people like me who are community safety fire officers, that's everybody in the fire service now. We regularly go out to people's homes, do a home fire safety visit at a time of their choosing, and we can make their homes safer, supply fire safety equipment and give them sound advice as to how to prevent fires from happening in the first place.
So home safety is quite a big thing for the service. Can you tell me more about it?
We often have people who think they are maybe safe in their homes. Fire prevention and home safety in fact, it is a lot of common sense, but if you have developed bad habits, it just needs somebody to point them out to you. Very simple things like closing doors at night, having working smoke alarms, making sure they work. Some people see them on the roof and just assume that's fine. You must test these things. We recommend you test them once a week. If you unplug electrical equipment at night as much as you can do and keep your keys near your door, these things can go a long, long way to make you safe if there is an incident in your house. Alongside that, as I said, we do working with my partnership colleagues. We can identify slip hazards, trips, falls, different things that we may have not been looking for from a fire service point of view in the past.
So how does the service work alongside other partners in helping people with specific illnesses like dementia, for example?
We often get referrals from our colleagues in the social work from various partners. Some of these are from people who are maybe having the onset of dementia. Obviously, this can be quite distressing for not only themselves but for their partners. We can get in touch with Scottish Gas. Scottish Gas can come along and we can isolate their gas supply, but not completely. In days gone past, we used to have to isolate it completely and they wouldn't be able to use their cooker at all. Now we can install a simple valve. It can only be opened and shut by a key, and a partner or carer, they can have this key and turn it on, turn it off at night and turn it on again in the morning when the gas can be used again.
So given the importance of the home visits and how they enable people to live safely within their homes, what measures have the service put in place? Well,
there is a system in place. It's already been around for a few years. It's a telecare alarm system. And basically, if an elderly person was to fall, say, they could have a pendant and they've just pushed the button. This will alert somebody and obviously they'll get help immediately. That's gone a step further now. We can supply detector heads. These will identify smoke in the building, and perhaps again, mentioning the people with the onset of dementia, they may hear an alarm but they may not know how to react to it. If these alarms are activated, somebody will try and contact the householder, and if they do not get an answer, a fire engine is sent to the door immediately. It's like an automatic fire alarm for your home. And this is a major step forward for people, especially elderly people living alone.
Finally, Graham, what's next?
Currently we're in the process of making films. The subjects involved are slip, trips and falls, dementia awareness, hoarding, and also signposting. This will involve letting people know what agencies can assist them with the various things and what technology is available as well. So we're trying to cover all the bases for these films that's coming up now.
Graham Barclay, thank you.
You're welcome, Nikki.
That's all from us this month. From all the team at Video 3, thanks for joining us and we'll see you again in September.